Welcome everyone. Thank you very much for joining us today. My name is Andrea Zatinka. I am a Circular Healthcare Project Officer at Healthcare Without Harm Europe. And today I will be moderating this session. So we wanted to have this session on this topic because there is a need for healthcare professionals for this knowledge to be shared with healthcare professionals, for it to be available, and they can also pass the message in their communities and make sure that the most vulnerable populations are protected. So thank you very much for joining. I know that you are very busy, so we appreciate it. We also want to share with this webinar some inspiring stories that can maybe motivate you to do some action. So we also had a session last week on the impact of plastics in healthcare in general and how to reduce it. And we will have recordings available for both of these sessions in the coming weeks. So you can follow our website for that. For the nurses who are joining today, we have international continuing nursing education credits for attending both this session and the one from last week. And if you need the credits, please get in touch with us and we will send them to you. To tell you a little bit about us, we are Healthcare Without Harm Europe. We are an NGO working to make the healthcare sector more sustainable. And we have a network of thousands of hospitals and healthcare leaders and professionals across Europe and the world. If you are interested in getting more involved, sorry, 1 second. Maybe David, if you could mute yourself, because there's a bit of noise, or maybe I can do it, or someone else can do it. Maybe it works now. So we have our action networks that you are welcome to join. The Global Green and Healthy Hospitals, which is for organizations, but also Sustainable Healthcare Leaders networks, including the Nurses Climate Challenge. You can join these networks as they are for free. And here you can get an idea of where our members are around Europe. We have 146 members in 25 countries. But this is just in Europe. We also have members in other parts of the world. And here is where our Nurses Climate Champions are in Europe. So you can see we might need more representation in Eastern Europe. So if you are from there or from anywhere else, really just feel free to join. If you join the Nurses Climate Challenge, we also have some resources available. These are resources that were created in collaboration with nurses that can help you to make your practice more sustainable. One example being the climate smart infant feeding. And otherwise, if you are looking for resources which are specifically on harmful chemicals in healthcare, here are 3 of our publications on this topic. They are all available for free on our website. So without more talking from my part, I will present the speakers for today. We have Elaine Mead, who is Executive Director at Improvement Care and Compassion, and she will be talking about harmful chemicals in the healthcare sector. Then we will have Anna Watson, who is Head of Advocacy at ChemTrust, talking about chemicals in our daily lives. And then we will hear 2 examples from the healthcare sector on reducing exposure to plastics and harmful chemicals in their facilities. And we'll have David Saura Lopez, who is environmental manager at Hospital Clínico Universitario Virgen de la Rixaca, and Dominique Licot, who is midwives coordinator at Centre Hospitalier Angoulême. So I will stop here and I will give the floor to Elaine.
Thank you so much, Andrea. And I'm really delighted to be with you today to share my own sustainability on a journey as a healthcare professional over the last 35 years in the NHS. My last role was as Chief Executive in the north of Scotland, a beautiful area, 41% of the land mass of Scotland with a very small population. And I've always felt that healthcare organisations have a social and economic and an environmental responsibility, a sense of place for the people, the visitors and the staff that we serve. We work really closely with Healthcare Without Harm, and although we were doing our bit for the environment, their work started to really open my eyes. Here's one thing that caught my attention. The fact that chemicals can leach out of the products that we use and have adverse effects. What effects were they? And who were they on? And more importantly, why didn't I know some of this? So my clinical practice has been as a diagnostic radiographer. I've worked all over the UK in that role in general hospitals, in research and academia. And my last role was being responsible for actually breast screening units. And in imaging, we've been very used to lots of chemicals. Of course, to produce films, we used chemicals mainly to process the films and sometimes to use materials to fix samples that we were imaging. We knew that they could be dangerous, and I remember, I have to say, some of those headaches described in this narrative here. Now, of course, the digital films we use have protected radiographers and teams from these things. But now I know that there are more chemicals that we were exposed to. Actually, lots more. And this document does describe in more detail some of those chemicals and the impact that they have described here on our health. The things that we use, and of course, the things that we need to use to provide care to our patients. Does it really matter that these things are hazardous? Well, here's some of the science. This is a small study, but back in 2009, where actually the outcomes were, for me, when I read them, quite worrying. Out of only a small sample, but of 20 participants, all of them, when they were tested, had at least 24 chemicals in their bodies. And 18 chemicals were detected in every single participant. I'm sure that if we tested most of us on the line today, we'd actually find the same thing. But where are they all coming from? How do they get into us? And we have to go back really to the 1960s to think about the development and actually the revolution in healthcare, where plastics were introduced as what we now call single-use items. We no longer need to clean them. We can open the packet and use one and throw it away. It meant, of course, that healthcare became safer, cleaner, maybe even thought of as better. But these plastics still come with some problems. We know that plastics need to be flexible for the uses that we have in healthcare, for us to be able to put them to good use for our patients. But actually, these plasticizers disrupt our endocrine systems. It's described here how actually they mess with our hormones, and that can't be a good thing. But because they are so good at what they do, we now are surrounded by them in clinical areas, from the furniture that we sit on, to the equipment that we use, to even the shoes that we wear. In fact, these chemicals are in everything. We found that we need them. We didn't really know that we needed them. Now we know we do. They're in coatings, they're in packaging, they're in clear things, they're in shiny things. Most importantly for us, they're in clinical things. And here you can see the list is very long of some of these chemicals. One of the hot favorites are PVAs. They have great use. They are fire and grease repellent. And so we can all see why they are quite important. And major industries use these every day. And because of that, they're in nearly everything that we hold, that we touch, that we drive. But you can see here they're linked to potential health issues. So here's the real issue for us. These devices are essential, and the chemicals that they're made of are a vital part of them. We're reliant on them. But actually, until recently, as practitioners, we didn't really know about them. The worry for me when I looked at this was, unlike drugs, these are not well regulated. The devices are made to standards, but it's the chemicals used in the production we didn't know too much about. So we need them. But the question for us today is, do we need so many of them? And for me, it made me think, what on earth happens to them? It opened up for me actually quite a scary new world of plastics and chemistry. And I realized there were lots of things, even as an experienced healthcare professional, that I simply didn't know. I was, in my practice and experience, responsible for a neonatal unit and many dialysis units. These meant that the patients we were looking after were in regular and prolonged use and exposure to these chemicals. Now, maybe with big people, that's not a problem. But with small babies, with developing organs, who could be potentially exposed to these chemicals and plastics for over 3 months, that could be a risk. And we didn't even know that that was the case. So while I was learning about this and thinking about this, I was reading quite a lot. And I read this book by Kathy Gerwig called Greening Healthcare. It was a story of an organization in North America called Kaiser Permanente, who you may have heard about. And I have to tell you, it made me angry. I found that actually there were alternatives to some of these plastics. A decade ago, Kaiser Permanente managed to get rid of some of them. They took action to find alternatives and then set about replacing. And here's an example of their administration sets to something that was plastic free. I had to ask, why didn't I know this? And if we do know it, should we say something? It is a dilemma for us. Do we want to be having these conversations at such a precious time in somebody's journey? So I look for some official guidance. Who says what we should be doing? And here in the UK, the Medicines and Healthcare Products Regulatory Agency are there to keep both us and our patients safe. And yes, they do have a comment on DEHPs. They know about it. They even describe the dangers of them. They tell us it's probably okay, but we don't really know. So we need some research. We need more research on not only the impact of what we've been using, but the alternatives that we may come to use. And I'm glad to say that some governments have listened already. France, bravo, is taking the lead in banning these materials from use with children and neonates. So well done. But here in the UK, hey, guess what? We're still waiting for some action. But we've been busy with another problem. Clearly, we've needed to protect ourselves and others through the use of PPE during COVID. It's created tons and tons of it. But did we really realize it contains so much plastic? Did you know that a surgical mask could take 450 years to decompose? Now, thankfully, here's a picture of some safe and reusable options that are starting to become available. But we really do need to think about whether we really need these things at all. Avoiding and reusing is better than trying to recycle or throw away. And we know we need to create less waste to become in healthcare more sustainable. And we need to think of this sustainability as an important domain of the quality of the care that we deliver. This is work from Francis Mortimer and the team at the Centre for Sustainable Healthcare. And they encourage us to promote health, to support patients to manage their own health, as well as streamlining care and, most importantly, finding alternatives which can also be better for the environment. So in your organisations, wherever you are, you should now really be sharing your expert knowledge of your own specialty with the teams who are already involved with and looking at some of these green issues, coming together to find sustainable alternatives and solutions to these issues. There's lots that you can do. And others today, I'm absolutely sure, will inspire you with their fantastic work. You can support environmental awareness locally. You can help staff to actually get involved and to do something. But for me, most importantly, it's to hear and to share stories, to really make it real for people. We know that we can't protect our children from the chemicals in plastics all of the time. But in healthcare, I would argue that we really should do our best to try and do that. Thank you so much. Thanks, Andrea. I'll pass back to you now, if I may.
Thanks a lot. Thanks, Elaine, for the inspiring presentation. Just to remind our participants that they can use the Q&A box to ask questions. I will now give the floor to Anna, and I will try sharing your screen. If that's, the presentation. Can you see it?
Yes, I can. Thank you, Andrea. That's super.
It's full screen, right?
Yeah, I think so.
Okay.
As long as everybody else is saying that. So
it should be fine.
I will just say next slide, Andrea, when I want to go on, but just give me a second. So thank you very much for inviting me to along to present today. I'm going to speak to you about harmful chemicals and how we can protect children's health from them. There are some of the things that Elaine has mentioned that you'll see in my presentation as well. So hopefully this will just keep reinforcing some of those messages. But I'm not going to be looking at the healthcare setting. My name is Dr. Anna Watson. Now, before you get excited, I am not a medical doctor. I'm an academic doctor. So please don't ask me any kind of detailed medical questions. I don't want you to be under false pretenses. So I just wanted to let you know that. Next slide. I work for ChemTrust. We are a charity who works at the UK, the EU and the global level to protect humans and wildlife from harmful chemicals. And we work at the science policy interface. So we work with academics taking the most recent research into the policy arena, sharing that with the decision makers and the regulators, and working with other civil society groups to basically ensure that we are better protected from the chemicals that we use in products. We have a website, we have Twitter, we have newsletters, we do the general thing that NGOs do, and you know, do have a look at a website, and obviously if you're interested, do follow us on Twitter. Next slide, thanks. So why are we concerned about exposure to chemicals and children's health? So as you've heard from Elaine, and she was sort of mentioning their sort of chemicals in the healthcare setting, we are exposed to hundreds of synthetic chemicals on a daily basis. But unfortunately, some of these chemicals are harmful, and particularly when we're thinking about children, they're able to disrupt the development of the brain. And chemical exposure now is so ubiquitous that babies are now born pre-polluted with a cocktail of chemicals in their bodies. Now, I'm sure you all know, and you'll be much more well-versed on this than I am, that the brain is obviously a very complicated organ, and it keeps developing until we're in our 20s. And hormones play a really vital part in normal brain function. So anything that blocks or mimics the action of the hormones can disrupt the brain's growth and development, which can lead to long-term, lifelong problems for an individual. For instance, scientists are increasingly linking chemical exposure during fetal development to an increase in intellectual and behavioural challenges in children, from ADHD to learning disabilities, impaired social reactions, and autism. And the chemicals that we're particularly concerned about are ones that, and Elaine mentioned these as well, the hormone disrupting chemicals that can impair the functioning of the brain. So this infographic kind of lists the ones that we're particularly concerned about, but you know, they will be more than this. This is just illustrative. So I'm sure you're very familiar with the bisphenols. BPA is one of the most used synthetic chemical globally. It's a known hormone disruptor, as well as some of its sister chemicals. There's a big family of bisphenols, its sister chemical BPS. They're used in food packaging. They're used in till receipts. They're used in tins, you know, as linings. And they're sometimes found in clothing. They are everywhere in our lives. We've also got the phthalates. It's a very, very bizarre set of chemicals because you don't pronounce the pH. They're also hormone disruptors. They're found in food packaging. They're found in care products, so soaps, shampoos, children's toys, and they build up in household dust. We've got the PFAS chemicals, the forever chemicals. They're highly persistent. We don't actually know how long they're going to last in our environment. They've been linked to thyroid and kidney cancer. They're used as coatings, as Elaine said. They're, you know, people like using them because they provide a water resistance, a stain repellency. So they're used in clothing. They're used in food packaging, particularly takeout food packaging. They're used in non-stick pans. They're used in cosmetics. And basically, it's almost like every single product that you test, you may find out that there's PFAS in it, and you didn't know. Dental floss, for instance, has potential PFAS in as well. We've got the flame retardants. They're obviously used to prevent things like our electronic equipment going up in flames and to slow the spread of fires. So you'll find them being used on, they get sprayed on, so they're not really chemically bound. They'll get put on sofas, on furnishings, car upholstery. And again, they build up in household dust. Got the pesticides, that's fairly straightforward. They're used obviously in the production of our food. And an example of one that is a hormone disruptor, a thyroid disruptor, is perchlorate, which is used to sort of sanitize food, sort of clean it before sort of it comes into our sort of, you know, the human food chain. And then unfortunately, we've got the legacy chemicals such as lead and PCBs. So even though they may have had their use restricted or they may have been banned globally, they are still present in our environment. So we've got these multiple families of chemicals that we're exposed to on a daily basis. Next slide, please. And just another way of thinking about it, if you take a room in your house and think about, okay, well, what's in it? You're gonna, there's gonna be various different ones of these groups and others. Don't forget, we don't know everything yet. So let's say on fragrances that may be used in cleaning products or in sort of air fresheners, they'll just have something that says parfum, and you don't have to list what those chemicals are, so we're actually in the dark. So this is just trying to paint that picture that on a daily basis, we are exposed to a whole host of different chemicals, and we come into contact with them, food, on our skin, breathing in, through all of those routes of exposure. And it's very complicated to think about how this sort of impacts on sort of children and, parents to be. So if I can just go to the next slide. Because, even though I've mentioned that there's a threat to the brain development of the fetus in particular, when we're preparing to bring a new life into the world, your past exposure is going to have an impact on your reproductive health as well. Now, I know often when we talk about reproductive health, we particularly focus on women, but it's important to note that men's reproductive health is also impacted by chemical exposure. So renowned scientist, Dr. Shana Swan, she's done a lot of work looking at the quality and amount of sort of the fertility of sperm, and she's found that between about 50 to 60, we've seen a 50 to 60% drop in the sperm count in industrialized nations since 1973. In several EU countries, there are now young men whose sperm counts are so low, they're considered subfertile. And, as we've sort of shown, there's prenatal and postnatal exposure to certain chemicals such as the pesticides and phthalates, and that is having an impact on reproductive disorders in men as well. So, with this, what we're talking about is, when people are sort of thinking about advice and looking for things on how they should protect themselves when they're pregnant or what they should be doing to protect their child, it's really important to think about the fact that our chemical exposure pathway is from the very beginning, and how it plays out during our lives is not a straightforward picture at all. Next slide, please. But obviously, as health professionals, one of the things that I'm sure you're giving advice on or are thinking about is, how to give advice to people when they are pregnant, and how can they possibly reduce their exposure to harmful chemicals. And I'm sure it's very familiar, and those of you who may have been pregnant yourselves, this will be a familiar idea of nesting. I know that when I had my firstborn, 6 weeks before he was due, I moved city into a new house. So people are doing renovations, they're thinking about getting their baby room ready. if they want to have a baby room, that is. So it's really important to think about, well, what can I do to protect myself, my own health, and also the health of the developing child? So it's things such as using water-based and low VOC paint, using natural floorings. A lot of people want to buy new goods. Unfortunately, I'm sure people are familiar with that smell that comes with a new good, like a new carpet or a new mattress or curtains, and it has a certain smell. That's the chemicals off-gassing. So if people are going to be buying new furniture, it's very important that they're aired and bought beforehand, or actually try to look at if there are things that you can, be reusing safely. Pregnant women, the advertising industry wants to make out that basically you need to be covering your body with vast amounts of creams and lotions, to look after your health and make you glow in pregnancy. It's a very good idea, in fact, to be cutting down and using very few personal care products, particularly unscented products. I've mentioned about the phthalates and other chemicals that get hidden in the term parfum. Again, the same with cleaning products. I've managed to bring up my children to adulthood with really one cleaning product and lemon juice and bicarb, and we're all very okay. We didn't sort of, we didn't have a whole load of different sort of chemicals in my house when the kids were little or anything. And obviously, as I've talked about, with the buildup of dust, the chemicals in dust and indoor air, it is very important to ventilate rooms. And unfortunately, for those of us who don't like housework, it is very, very important to remove dust, unfortunately. I hate to have to say that, because none of us should be spending our lives doing housework. Please go on. Thanks, Andrea. But one of the most common ways that we are exposed to harmful chemicals is through our food consumption. And obviously for people who, it's very common that people who are pregnant are being told by health practitioners that there are certain things not to eat or to cut down on. So we know that certain chemicals such as mercury build up in fish, in the food chain, particularly the fish that's sort of at the top of the food chain. So, people are used to that sort of advice. But what people are unaware of, and I know Elaine touched on this as well, is the amount of chemicals that there are in other products you might think of. So, in food packaging, in tableware, and these chemicals that are used to produce these goods can leach out into the food. Plastics is a particular problematic chemical to be using around food, particularly at higher temperatures. So the chemicals tend to leach out the higher the temperature is, and the plastic. So definitely advice around not cooking in plastic and trying not to store food in plastic as well. Next slide, thanks. So providing advice, practical advice to parents to be is obviously really important. We need to get these chemicals out of everyday products. And until we win those campaigns, unfortunately, people still need to know how to reduce their exposure, but there are some really, really good resources out there. And there's just a couple here. There's one here from the Women's Environment Network based in the UK, and there's one here that was put together by Figo and Heal and others, and it's in many different languages, and I've got a link to that in the presentation. Next slide, thanks. But of course, then your baby comes along, and the advice really, remains the same as any advice there would be for us or, people who are pregnant about reducing exposure. Unfortunately, all of these products listed here, they've all at some point been found to have concerning chemicals in. So nappies have been found to be contaminated with dioxins, which has come in through the bleaching process. So advice to parents to be about using kind of bleached disposable nappies. I mean, obviously environmentally real nappies would be preferable, but there are also some nappies on the market which I think are unbleached. Again, the advertising industry that Johnson & Johnson and others would love us to think that your baby is never going to survive to adulthood unless they've got lots and lots of different care products. water and simple non-scented soap probably, you know, clears up most things that your you know, a child may, you know, kind of need to be cleaned. Toys, unfortunately, can contain banned chemicals, particularly ones that are cheap and have been imported, maybe bought online, but also Arnica, an NGO in the Czech Republic, they found that toys were contaminated with brominated flame retardants because they were being made with recycled plastic. So, you know, as we look to reuse things, you know, children and babies can come into contact with chemicals that people they never ever should have come into contact with. Those products were never designed to have those sorts of chemicals in. So that's again why it's really important that we get chemicals out at the beginning of the process and not have them used in products in the first place. Babies, you know, toys, you know, clothing, sorry, exactly, it's the same thing, that that can be, you know, protective, sort of, you know, waterproofing or stain resistant clothing for children can be covered in chemicals. Just recently, there's been a bit of work looking at the fact that children's socks have got BPA in them. And then we come to things like babies' bottles. Now, there has been, you know, I'm sure many of you are very familiar that BPA within Europe now is no longer being able to be used in kind of food materials for babies and young children. However, there was a paper in Nature Food just a couple of years ago which found that the polypropylene infant baby bottles did leach millions of microplastics per litre into the infant formula when the infant formula was prepared in them, so heated up and shaken. And the scientists said that on average, a bottle-fed infant could be ingesting 1.5 million microplastic particles per day. We're unaware, we don't know all of the health impacts of humans being exposed to microplastics, but that's obviously a concern with the use of polypropylene infant baby bottles. If you can just go on to the next slide, thanks. I mean, all of this shows you, hopefully, you know, that there is absolutely no place for harmful chemicals in our everyday products. And we can give advice to parents to be. We can give advice to, you know, health practitioners about trying to reduce exposures, but really it is absolutely impossible to reduce our individual exposure by large amounts when these chemicals, particularly the hormone disrupting chemicals and others, are so ubiquitous and in many of the goods that we use on a daily basis. And every year, a delay in banning harmful chemicals in products obviously threatens the health of future generations and also the environment. And so this is why organisations like ChemTrust that I work for and others are working hard for better chemical regulation. So we want to see a ban on the most harmful chemicals being used in consumer products by 2030. We want to see an acceleration of the identification of hormone disrupting chemicals and also the highly persistent chemicals such as a PFAS that last in the environment for a very long time. And to address the fact that we are actually exposed to, you know, a cocktail of chemicals, we're calling for a mixtures assessment factor to take that into account, rather than, you know, sometimes the risk assessment is done and it's like, right, you're only exposed to bisphenol, or, oh, and now we'll work out what it's like if you're exposed to phthalates. And really, we've got to we've got to look at the real picture of human exposure to these different chemicals. And also we want to see that chemicals are regulated as groups of chemicals. What we've seen is the bisphenols. There's been some brilliant work to start to sort of remove BPA from products, such as I've mentioned, babies' bottles and also in till receipts, but companies have started using BPS. It's in the same family. It's also a hormone disruptor. So we need to make sure that we see regulation across the family groups. So just the next slide, thanks. So I really urge you to find out more, to talk about this, and if possible, to join any sort of calls for action. And I know you're obviously interested because you're here on this webinar, and Healthcare Without Harm have a lot of wonderful information to give you, but there's also other organisations, there's ChemTrust, there's HEAL, many of these are working at the EU level, Women Engaged for a Common Future, the Break Free from Plastic movement, and Toxic Free Food Packaging have more information about toxic chemicals in food. So I'm really hopeful by all of us starting to find out more and discuss this and get together, that we really will have a chance to protect future generations from harmful chemicals. And just my last slide is just a list of some resources, which I think would be very, very, hopefully people will find interesting. And there's some of the ones that I've drawn on today for this presentation. So thank you very much. And that's the last one. Thanks. Andrea.
Thank you. Thanks a lot, Anna, for this insight into how harmful chemicals are kind of all around us, but also some practical examples on how to reduce them. But of course, what we truly need is better regulation to not have these chemicals at all. Okay, now that we heard a little bit about the problem that is out there, we wanted to share with you some examples of what healthcare facilities are doing to protect these vulnerable patients.
Well, I hope I don't have any technical issues as Dominic had. We're going to explain what Virgen del Resaca Hospital, Virgen del Resaca in Murcia, Spain is doing. I'm going to tell you a bit of how we've designed a plan to reduce the consumption of plastics in the hospital. All many thanks for the initiative at HMUH. We've always worked in the hospital with the idea of trying to reduce the risks to families, but we were, to be honest, we were a bit stuck when we started the project. We started the project in 2020. I'm going to now convey to you what we have been doing as the University Hospital in Ansaca, which is a reference hospital in the Murcia area, and we're working with one of the only two units in Spain, PEHSU, and we also work on environmental management. Here is the link if you like to consult what we're doing. What we're doing in environmental health. It's a unit that we work together with pediatricians, as well as nurses, environmental professionals, etc. As I indicated, in 2020, at the end of 2021, but we started actually on 2020 together with, we started working on this project, and as a consequence of this, in 2021, we approved an action plan containing 12 points. How have we designed this plan? Well, to start off with, following the methodologies published in the link I showed before, we started off identifying which are the plastics that are more important or that contribute more towards in our hospital. Here, for example, we identified 5 or 6 articles that contribute substantially, 70%, then the others with less, and other ones that have very low contribution. We've identified that range of products of plastics used in medical settings. The second point in this action plan, we complemented this information carrying out an audit, and in this moments of an audit, this allowed us to contrast the information in our previous stage, and we also identified plastics that weren't in medical use. majority of these plastics, we don't have an option we knew that the first actions, and that was priorities, was to focus on what's happening maternity unit, neonatal, or UC, or ICU. That's where we wanted to reduce the plastics the most. As a consequence of this, we designed the following graft. We showed before. It's always better to prevent. It prevents than waste, but in our concept of eliminating plastics, we always thought that it was important to reduce plastics and also focus on the reduction or the exposure of microplastics on patients and employees. And finally, as an alternative, we would try to improve the recycling of these plastics. How did we identify these action plan, or these points in the action plan? Well, it was very important to create a working group. It's important to share knowledge, to see what other people have been doing. It's important to know that maybe the idea we had on our own, it's a question, knowing that what other people have been doing, where we great part of our action plan was based therefore on a previous experience that we identified in this group working action group. I would recommend that when you identify these measures, it's always important to share experiences and initiative, but must always be based on science, the scientific concepts. It's always important to hear people's opinion, always think of change, little steps, step by steps. It's important to take little steps, even if they're little steps, one after another, and also thinking what we are able to obtain, not thinking it might be difficult or not, but thinking that we can always obtain something. When we designed this project, we always took into account criterias, or different criterias, if you like. Here, for example, the contribution that the plastics have, the article in the plastic flow, previous experience, availability of alternatives, economic effect. We also took into account legal or legislative rules, also the effect that these plastic can have on people. For us, for example, it was clear that it was so important to reduce, or take into account, if you like, the total reduction of these measures, as well as the effect to reduce risks for patients and staff. Along this line, or based on this concept, why we focused on maternity and neonatals and UCI, ICU. Why? Because we have always worked on advising and informing families in pediatric ward as regards to what they must do outside the hospital setting. Amongst themselves, for example, we recommended, like things like Anna recommended, that we exposure of different plastics with children. So the issue is that this advice that we give, it's very easy to give advice in hospital. However, however, we do things, we don't do what we preach in our hospitals sometimes. And this isn't very positive. Why do we think maternity ward is a priority? Because they consume high contents of plastics. Also, because it is there where the patients are maximum vulnerability of patients are amongst this group of patients, like Anna mentioned, maximum vulnerability of these young children for microplastics as well as additives. And thirdly, because the measures here have high visibility for parents, if you're telling or recommending them to carry out certain practices, but they see that we do the opposite, then that's not counterproductive. And finally, because we believe that these patients or these families, they have those moments when there's a birth, they're predisposed to continue with these actions once they leave the hospitals.
Okay, I'm going to tell you about some of the measures that we have taken. Some of them we have already developed, some that are in process, and comment on some of them. Hopefully the experience is going to be the same. During the execution of the project in 2020 and 2021 in this case, we were in the implementation process for the breast milk bank. And that was a policy, as I was saying before, the use of glass whenever it was possible, instead of using plastic. But when we started working to get the equipment for milk processing, we found that the equipment market was pretty much forcing you, they direct you to use pasteurization systems using plastic bottles, disposable, one single use, of course. And there are not an article which only have a small contribution to plastic exposure, but the maximum exposure and the maximum liability for the patient and the maximum risk of migration of components, because there is a heating phase, the high visibility or capacity of influence on families regarding with the hospital's policy, and the existence of alternative materials such as glass and alternative systems based on reuse. What the market was offering us, our experience was one that put us in this part of the pyramid. We needed to act on the market so that the market would redesign their systems in order for them to be compatible with our purpose. So what was the market vision? And many hospitals are still facing this situation. They face that the market will tell them, or whoever manufactures and sells this equipment will tell them that the single-use sterile material is plastic. And we were saying that sterilization has to be guaranteed, but we didn't need for them to be disposable. And second, that plastic bottles meet the EU directive. And we were saying that legal is not the same that as unharmful. Another argument was that the use of pasteurization system of the breast milk banks, they were designed to use plastic bottles because they're easier to be hermetically sealed. And we needed to be compatible with our policies, with our breast milk policies. Another typical argument that plastic bottles are disposable, they are recyclable. The false promise of recycling. And we were telling them that we were thinking of a system that was in agreement with the life cycle. And we were looking for another viable option. And they kept saying that all milk banks we're using disposable plastic bottles. And if this is true, which it is, we need some more environmental training in the hospital sector. In this case, there was a process of redesigning, and the manufacturer said that was something completely impossible. And now our bank works exclusively with glass bottles. Another article in which we are working at the moment, and we are planning to apply it in the whole hospital. And if we have to select an area of activity in the hospital where to start, it is going to be in maternity and neonatology. These are the IV solution packaging, and we're talking about an article that has a very significant position within the graph. So we're talking in the end of an article that affects 10% of all the plastic flows, according to an audit and procurement study. So you have a more maximum reciprocity in the use of plastic and maximum relationship to nanoplastics and additives. So the alternative for us is to use glass. The market here has an influence. It's not only a hospital decision. We, about a year ago, with another 3 hospitals, nearby hospitals, and what you see here in Arisaka, it was the only one that kept 1/3 of IV solutions, or we're doing it in glass. And predominantly the sector is using plastic. Someone also told us that the glass option meant an increase in the carbon footprint in the sector supply chain, because it generates more waste. And we have criteria, and we have to say that, at least in other case, not everything is a carbon footprint. We have to take into account other environmental aspects. And this happens in Spain, and I believe in other countries. The IV solutions without plastic have no alternative. And we were only talking here about linear economy. And in this case, using glass allows us to introduce waste in a recycling system. Another action, one of the most important ones that we are piloting at the moment, is the removal of bottled water. During the audit we had during the project, we estimated that in the whole of the Murcian health service, we were using 3.6 million bottles a year, and 20% of the plastics for non-medical use are for water. And also, it's another source, in this case non-IV, is another source of exposure to microplastics in the hospital and in maternity. I don't know if you can see this. Can you see this? Yes, we can. It's a bottle. What do we do? And in Spain, in the southeast region, the consumption of bottled water is widespread. The running water has a very nice taste and smell, and we have to recourse to some sort of system that improves the systems, and we are given the option where we give this bottle to the patients. And what I wanted to highlight was that in the bottle, we have access to a QR code, and in that one, we explain the family why we're doing that. Why are we doing it in environmental sense and in the health sense? And from then, starting from the example, we tell them about the impact of the waste. And what we tell them is that there are recommendations. We can assess them and tell them not to use plastic bottles at home, that follow the recommendations we were given. But we also give them the examples so that they can see that in the hospital, we follow that example. And finally, we have also implemented in an audit, particularly in the case of maternity, that only 2.9% of the recyclable plastic, the medical use, but also recyclable, are put in the recycling containers, which is quite easy because the patient didn't have access to recycling bins. And the other thing we did was give them access to bins, to containers, and explain to them why we need them to do that in the hospital and then after at home. And with this, I'm going to finish. Maternity, neonatology, and pediatrics are the best places to start with, and with the recommendations of the plastic use for the sector, to point out that small things are important to encourage people. It's small things that are the beginning of big changes. And maternity as an opportunity to reduce the risk linked to the use of plastics in and outside hospitals is very important, and to take advantage of that, to try and promote that good practice within the family. We understand that we need to integrate environmental health with activity, the living activity, and we have to be realistic. We need plastic. We can't prescind of them. We can't get rid of them, but we have to be responsible and coherent. And again, the fact that it is legal is not the same as being harmless. And as we have seen, there are things we can do. And with this, I want to thank you for your attention.
Maybe we can cover a couple of questions for David, if that's okay. So one of them is, how did you get over issues of infection control and health and safety, introducing glass into wards for water and for IV? How did you get over issues of infection control and health and safety, introducing glass into wards for water and for IV, for intravenous?
Well, for intravenous use, well, I don't understand the question there, because they're products that they come with a solution. They come the same composition, both in bags or in glass. There's no counterindication. In the case, however, of the bottles, glass water bottles, the issue here is a bit more complicated, but I have to indicate that first of all, this is resolved This is resolved, making it a request, if you like. We don't want to impose this. We want to make this a request from the health professionals. And then we've analyzed all this with preventive medicine and reached the conclusion that we give the patients water in bottle, but the water that they have available in the taps in the hospital is also drinking water. But if we don't eliminate drinking water in the taps in the hospital, why not give them the option to give them purified water? These bottles containing water are not adverse osmosis. The treatments of the water should not mean an excess consumption of water. They're simply teams that treat the water, the tap water. They don't store it, they don't accumulate, so therefore there's no risk that we have water which is unprotected. This water, if you like, comes directly from the tap, and then it's active, and there's carbon filter, and this improves substantially the quality, and let's say quality of flavor and taste of this water that we provide to our patients. This is how we did it.
Right. So the actions which have launched since 2010, 2015 in order to reduce exposure of children to endocrine disruptors as a whole, with the fact is one less pollutant is one more chance of health. We started in 2015 to thinking about the idea of sustainable development. We recycled mini plastic mini bottle baby bottles locally in order to reduce the carbon tax, because we didn't actually recycle these baby bottles. We talked about the person in charge of sustainable development in the hospital, and the proposals made by industrial groups were very far away from Angoulême, in fact. So we pushed the 4 industrial groups concerned to locally collect products in order to reduce the carbon tax. In 2022, this year, we launched an additional action thanks to the example given by our Spanish friends. We knew that there were glass baby bottles which were being used in Europe. So we demanded from the industrial companies to supply glass mini baby bottles. I could say to the first companies which were ready to adopt glass that they would have the exclusivity in terms of supply. So currently we only have one industrial group which comes to the Angoulême maternity ward because they offer glass baby bottles. No one else comes. So for other people, it's a loss, really. And they've started to think about adopting glass because they can't afford to not follow the example of our maternity ward. They don't want to incur financial loss because a lot of other maternity wards are doing the same as us. So it's very important. It's very important to be able to know that we could actually push and influence industrial groups in order for them to change their practices. But of course, it's thanks to the example of our Spanish friends. So we no longer use plastic baby bottles. We have organized nesting workshops. There are 14 of us in the maternity ward. We no longer talk about plastic baby bottles to parents. We only advise them to use stainless steel or glass. Now, we, of course, in order to get all of this, we also had to show parents what was best for them, including the transformation and the work that was carried out in baby rooms, and from a room which was a storeroom with no windows, we actually made this room into a baby room. We used tapestries, paper, paint, glues without formaldehyde. We put down some tiling, as you can see here, and you have the plastic, which is the hospital plastic, and there's also a floating floor next to it. We advise the use of tiling because it's neutral and which doesn't keep within its structure pollutants. Now, this is the finished room. We have furniture there, which is 15 years old. About 15 babies went through this little cot. We actually put some windows. There is no window in that storeroom. So yeah, a photograph here of a window. You can see the National 10, which is a major thoroughfare with lots of lorries on it. It's a road. So of course, we advise airing the rooms, but not at any time. And that's why we show this. We have next door to our ward a factory, a cellulose factory, a paper factory. We talk about clothing. We have 2 drawers. One drawer with some clean linen, which we bought in supermarkets, clean baby clothes with little plastic tags and paintings on the clothing. And here on the right, we have made a mother very happy because she'd already given birth and she'd already used these baby clothes. And that's what we actually advise. Use second-hand clothes. Clean, of course, wash them twice before you use them, and preferably without plastic, without phthalates and or other pollutants. In our workshops, we have a cosmetics and care, body care workshop. We looked at cosmetic products which have less than 10 ingredients in them, and a Cosme Bio label or EcoCert label. We talk about adult cosmetic products and household products, so food containers, toys. We here, through these toys, we explain the issue of children putting those toys to their mouths and sucking on them, which is also a contamination problem. This is what our workshops look like. We trained several hundreds parents since 2018, and there are 14 of us as facilitators, because within our building, we have peripheral buildings. We have 2 hospitals with neighborhood perinatal centers, which are about 40 kilometers from our hospital. So we have launched these nesting workshops within the premises of these various satellite hospitals, if you wish. Now, in order to do all of this, to do this for the satellites, we did not redo the baby room, but we actually created a model. We can take it with us. It's a kind of a mock baby room, and we show that to our parents. And we also have a booklet, an information booklet. So we have worked on food containers. For breakfast, for example, were modified, and right now we have porcelain or stainless steel. Now, the packaging of food has also been changed. Before we had individual portions, and now we have bulk for jam and cereals. For fruit juices, we have 2 actions. First of all, only glass containers and local seasonal products coming from sustainable agriculture. You have links in this diaporama, and you'll be able to look at the reports which have been made following our actions. So this is the result. You have bulk jam, you have the breakfast in the middle, very little plastic, and now we need to work on plastic yogurt pots. Now you can see bulk fruit, you have bread in a proper container. Now mothers before COVID could come and eat in our sort of parents' room, but now they come and they use a self-service, you know, in the same way, but they eat in their bedroom now. So it's the same principle of self-service, but they eat in their room. Now, as far as lunch is concerned, we're very lucky because we have not changed. We've also had these glass jugs, which contain tap water. Here you've got a plastic cover, but the base itself is porcelain, and we can't really do much about that in terms of transport. Now we need to, again, you can see that you have a plastic container, but it contains a cold product, but you have a very oily sauce on top for this salad, with this, of course, first course. And you know that chemical products actually travel better with heat. Now, since 2018, we worked on cleaning and disinfecting all the incubators for babies, and we have all the cots, and we have the tables, and now we are working with Selva, which is steam producing instruments, and we no longer have chemical products for the cleaning of these incubators. The first alert we had is that we were actually dropping these covers in a disinfectant, and this disinfectant was such that the incubator became opaque. You couldn't see the baby through them. So we thought that if the plastic changed, then the air, the atmosphere inside the incubator would actually not cause too many problems. So we thought about this, and we thought, let's use steam. So they are no longer chemical products within and around the incubator, the baby incubator. Now, as far as the mother's environment and cleaning floors, before we used to have this kind of sweeper with, you know, oil infused, chemical oil infused bands. Now we use different systems. You have an electrostatic microfiber band with no chemical products, and the microfiber cleans the floor, removes all the dirt on the floor, and then we have another microfiber sweep with just water in order to finish cleaning the floor. But you know, it looks wet, and it gives you the impression that it is actually washed, but in fact the bulk of the work was done by the first microfiber. So we use this in the maternity wards. We don't send all of this to the laundry, because you know, through the washing tunnels you have a risk of contamination. So we don't do that anymore. We've talked earlier about endocrine disruptors in terms of infusions, etc., and IV administration. A premature baby is, of course, 100 times more exposed than an adult to toxic products. So we have studied all of this. So we are with our pharmacists and Madame Levado and Monsieur Boucher, we worked on this this presence of DEHP in medical instruments, in obstetrics and neonatology. We have 270 of these instruments which have been listed. We have worked on the residual rate of ethylene oxide in the residual rate of OE, specifies for 1 dm by 130. So we have added criteria, purchasing criteria, and now there is an absolute need to actually state the presence of these two categories categories of products. So we always choose when is possible, less controversial medical instruments. Okay, very quickly, the final exposure, well, our final objective is to reduce the exposure to phthalate and others of pregnant women and newborns in our establishment. And this is in the specs of the bids that we make. And if the laboratory does not actually meet our request of mass concentration, well, we do not actually get supplied by them. We've also worked on cosmetics. This cosmetic aspect, which we had in the maternity ward before 2018, we used, we had all sorts of samples, cosmetics coming from various laboratories well known in France. And we also had the pink box, which was offered to mothers and which contained, nappies and washing products, etc., but without, any criteria, any remarkable criteria in terms of the impact on the health of children. So we wanted to actually ban all the products and all those, in fact, those presents that we gave to women, and they're not complaining because, as David said, laboratories say that glass baby bottles are good for carbon tax, but we don't talk about endocrine disruptors when children, drink their milk and they drink plastic at the same time, and it's the same for cosmetic products. We were told, okay, we're making a lot of, the producers made a lot of effort, but they say we can't manage to produce less than 10 ingredients. But we found something in our region, which is a cleansing gel with 3 ingredients only, which works very well. And this is particularly for mother and baby. As far as the umbilical cord cleaning is concerned, don't forget, sorry, we have an interference, someone talking over us. Okay, so again, we disinfect and then we rinse with water, and we use a very soft cleansing, a mild soap. Okay, now, thanks to all this work, which was done in the purchasing service, in technical services, in environmental services, in laundry services. All this means that we have the highest quality label. We have a score of 94%, and we are the second French maternity ward to have obtained this particular qualification, this label, this award. We are very proud that we actually started this change. The last thing is the idea of washable nappies in a maternity ward, and that's what we did. We no longer have these the nappies that you buy. If parents don't agree with washable nappies, well, they can bring their own. But we are trying to show, to actually show them the way and to lead by example. We worked with 2 companies, the Association Régionale and a local company that you can see, and the AMA company, which is another supplier. We got it through the internet. My grandmother always used to say, don't put all your eggs in the same basket. And that's what we've not been doing. Now, okay, this partnership of Aru Atelier and the Angoulême Hospital was led to work from 2018 to 2021. So we, in 2021, implemented washable nappies, but it wasn't for premature babies. So we started with the neonatology service, but we had a problem because premature babies are very small and the nappy is too big for the volume of the baby itself. So it was difficult on the hips. It wasn't good enough. So we only now we worked with the maternity ward. We used nappies with less chlorine, and washable nappies, which are more tailored to the baby. Now, this is the workshop. Now, this is remarkable because all the people who you see on this screen are people who are who had lost their job. They didn't know how to get included at social level and to re-include themselves in normal society. And you know, these people for 2 years worked on a prototype which was implemented in May 2021. So thank you to this team who, despite our regular returns, because it wasn't right enough. I wanted for the nappies to be white, for example, you know, as white as a hospital. You know, it's an old concept, I know, but you know, don't forget that the problem was that the feces of a baby at the beginning are very black, so parents didn't want to clean these nappies. So we started talking about color. So you can see these nappies with this concept. So parents can buy, can rent, and the inserts are also supplied. And you can see that you have little studs, so they actually move with the size of the baby. So that's a plus for parents. And we also are very lucky in Charente, in the Charente region, because we have Angoulême, which wanted us to promote washable nappies. So there is a subsidy that exists. I'm sorry, the interpreter apologizes, but the echoes come back. So we have a consensus, a local consensus, in order to help parents to really change their practices. Now, at the beginning, in May 2021, we were talking about 25% of you know, new use of these washable nappies. Now it's 50%. So I'll hope that I can be that I'll be able to tell you 100% very soon. Now, other actions for for women, mother and baby, and pediatrics. So here you have, in order to avoid trauma of an IV drip, for example, we have people who created these little, you know, these little covers for the drip, and you can see. But for some stuff is. Well, a glass IV infusion is still a big problem in France, so we're not got yet to glass, but we will change. We will change. Here you have a little splint to keep the IV on the hand of the child, and you know, you have before we had plastified bandages, and now we use all of this. You know, all these things that were made by the team. In terms of baby bottles, we have a baby bottle unit to prepare the menus for children. So I'm sorry, but we do have an echo, so the interpreter is doing her best. Okay, we try to reduce the quantity in the plates. Before, we used to cook the meat in this part, and that's plastic. So an agent said, well, hang on, it's plastic. It's not very good for children. Is there an alternative? And she found the BBV cook, and the baby cook has stainless steel accessories. That means that the food preparation for pediatric children is now without plastic. And that's extraordinary, you know, have a team which is so full of proposals of that type. Now, you've seen, of course, the food trays. It's the same principle currently. This is something that has been, that the team wanted to eliminate any plastic in there. So in the Limousin, the next door department, we talked about, of course, Limoges porcelain, you know, the porcelain from Limoges is very well known. And in the nurseries of that town, they have worked on removing on the children, say, whatever was plastic, and the small little punnets which were in plastic were eliminated in order to have a plate with compartments, as you see here, with different compartments, and with portions which are tailored to children. So this is going to be our next challenge. We want to serve children in this type of plates with compartments, and plates in China, made of China or porcelain. Okay, the neonatology has also done quite a lot of work. They have done, you know, little bathrobes that you can see with little hoods. We have a partner who gives us fabrics, and they make all of this. We no longer use cotton. We use little, well, cotton wipes or microfiber, you know, washable wipes. Sorry, and when you've got sort of a material left where you can use it to make little things for babies coming out of neonatology. Okay, now the animal world and the human world are the same, so it's the same battle. So the battle is the same. So we can see the catastrophic drop of spermatogenesis, and I was wondering if everybody would have to be medically assisted to be procreative. It would be a real issue, because if you have a direct injection, as I say, of the sperm into the egg, it's not really natural, and it can cause, of course, problems. You need to guarantee the vivacity of sperms. You need to guarantee a genetic capital, which will remain. One last recommendation is which appeared on the 15th of November, which we showed the impact of fertility. You can see on some areas, some question marks, there no longer is, because the drop in birth rates is worldwide. So major questions, well, of course, these major questions has launched the dynamics of the work that was carried out in order to progress the exemplary actions which we have carried out in our service. We want to ensure the future of future generations. We want to ensure the future of humans. Of course, we want to promote the existence of midwives, because without children, I don't exist. So I trust that humans have sufficient resilience to think, to ask the right questions, and to change these practices. And of course, I have trust in the medical teams in the various hospitals in order to make things change. Thank you very much for your patience.
Thank you. Thanks a lot, Dominique. I'm glad that we still got to listen to your presentation. Thanks to everyone who stayed with us despite it all. And yes, also thank you to the interpreters who did an amazing job. So yes, I'm very thankful. And I'm also glad to see how you, Dominique, got inspired from the work done by David, and we hope that this will keep going. So I will close it now because we've already stayed quite a lot. Thank you very much, everyone, and have a lovely evening.